It may come as no surprise that in the early months of COVID-19, more than 40% of people surveyed said they skipped their medical and dental care appointments. The reasons included their offices were temporarily closed or they were afraid of being exposed to COVID. What the researchers found back then was that more than half of those missed appointments were for preventative care visits and general outpatient medical services. So, where do things stand today? What do you need to know before you schedule or cancel your next appointment? In our three-part mini podcast series, Lessons Learned from the Pandemic, we've invited Stanford's leaders and top healthcare professionals to share their insights on topics ranging from the community's response to primary care and prevention, as well as mental health. Today, we're exploring the topic of primary care and prevention.
Joining us for part 2 of our 3-part series is Dr. Henry Yoon. Dr. Yoon is a board-certified family medicine physician and the medical advisor for the City of Stanford Department of Health. He's here to talk to us about how we can all do our part to maintain our primary health care and prevent more serious health conditions from arising. Welcome, Dr. Yoon.
Thanks for having me.
We're so glad that you're here to talk to us.
Yes. In our first episode, we had an opportunity to talk with Mayor Caroline Simmons and Acting Director of Health Jody Bishop-Pullen about the tools that are available for COVID prevention. Today, we're focusing on primary care and preventative care. But before we go further, Dr. Yoon, can you explain what do those terms mean?
When it comes to primary care, I often think of it as a role. Whether it's done by a physician or a nurse practitioner or a physician assistant or a nurse or a medical assistant, they're all part of a team. And they're the person or the people that really are your go-to when it comes to your healthcare needs. Now, granted, as a primary care physician, I may not know all the answers. And if you ask my wife, I generally don't. But if I don't, I think I'm a good place to start the question of where we can find those answers. So, as I said, primary care is, I think, a role. It's what I do. And part of what I do is primary prevention or preventative care. What that focuses in on is what are the things that we can do to prevent disease before it happens. Tools for primary care or primary prevention include things like education, lifestyle, diet, exercise. I know those are bad words for some people, but it's important that we talk about these sorts of things. Now, another strategy that we use is infection prevention. Stop me if you've heard this one before, but hand hygiene, social distancing, masks, vaccines, right? These are all techniques that we use to prevent disease or the spread of disease. Part of preventative visits is talking about safety. Whether it's seatbelts or gun safety or sports and sporting equipment, these are all important points to consider when we're talking to our patients and really trying to individualize them to their needs and to their risks. COVID has really put the spotlight on a number of these issues surrounding primary prevention and primary care. And it showed what happened when we use these tools properly. For example, if you think about it, what was the go-to strategy that we used to stop the pandemic? It was infection prevention. It was vaccines. It was education. It was guidance from your PCP, right? That was the go-to strategy. Treatment was important. Don't get me wrong. I don't want to offend all those great physicians and medical teams out there that were treating all those sick people. And it was very important. But remember, where did we go first? We went to primary prevention. And so the pandemic also showed us what happened if we stopped using some of these tools as well.
Thank you for bringing that topic up because as we mentioned earlier in the pandemic, many people were putting off or canceling visits with their doctors. What were the ramifications of that?
People stopped seeking care in both the inpatient and outpatient environments. And we saw this in hospitals all over the country where numbers of conditions that we would expect actually went down, right? So the number of heart attacks, the number of strokes, the number of episodes of, colon cancer management, things like that, all those numbers in terms of inpatient admissions went down. Now, I don't think that anyone believes that they didn't happen.
Right.
People just delayed care. They didn't want to come in, whether it's the office, emergency rooms, hospitals. And it was because they were afraid of catching COVID, right? They were afraid of coming into contact with quote unquote sick people. So what happened? We're seeing the effects of putting off these preventative measures now. So people are behind in their preventative care. And conditions that really required checking in with your providers, those probably didn't go as well as they could have gone, had we addressed them earlier. I think patients are starting to get back into their healthcare routines, and that's going to be really important.
And that's great because we were a little surprised to learn that even 2 years later, some people are still reluctant to schedule their healthcare appointments. Can you tell us what steps can people take so that the same thing, this ripple effect, does not happen again?
We know that COVID isn't going to go away anytime in the near future. So finding a primary care provider and a medical home is going to be very, very important for everyone. And it is always best to do it now as opposed to doing it in an emergency.
Dr. Yoon, do you have any other suggestions or tips you'd like to share with us as we all look to do a better job of caring for ourselves?
I think I'd be remiss if I didn't mention another condition that COVID has really highlighted, and that's mental health issues. It's very fair to say that we've all experienced stress or had mental health challenges, or definitely know someone who has during the pandemic. And I think we have to remember that wellness or being healthy is more than just the absence of disease. So I'm going to go back to the idea that a primary care provider is a great resource for your body as well as your mind and your spirit. And, I'd like people to remember that our role in primary prevention starts long before problems develop. If we're doing our job right, you'll never know that we're here.
Those are great points.
Yep.
Well, that brings a close to this second episode of our three-part series on lessons learned from the pandemic. Thank you, Dr. Yoon, for joining us today to discuss primary care and prevention and for helping us and our community understand the importance for each of us to do our part to stay healthy. And if you haven't heard episode 1, the Stanford Community's Response with Stanford Mayor Caroline Simmons and Acting Health Director Jody Bishop-Pullen, we invite you to take a listen to this fascinating and informative episode. Be sure to come back for episode 3, where we'll be exploring COVID's impact and lessons learned on the topic of mental health.